Three waves of COVID-19 pandemic. The COVID-19 pandemic has swept across the world and impacted nearly every aspect of life, leading to profound social, economic, and political changes. One way to understand the impact of the pandemic is to look at it in terms of waves. In this essay, we will examine the three main waves of COVID-19, their characteristics, and the reasons why they occurred. The first wave of COVID-19 began in late 2019 and early 2020, when the virus was first identified in Wuhan, China. At that time, little was known about the virus, and it quickly spread to other countries, including the United States. The first wave was characterized by widespread confusion, fear, and misinformation about the virus, as well as a lack of preparedness on the part of many countries. As a result, the first wave saw rapid spread of the virus and large numbers of cases and deaths, especially in places where health care systems were overwhelmed. The second wave of COVID-19 began in the fall of 2020, as the virus resurged in many countries after the first wave had subsided. This wave was characterized by the emergence of new variants of the virus, which were more contagious and caused more severe symptoms than previous strains. The second wave also saw the implementation of more strict measures to control the spread of the virus, such as lockdowns, travel restrictions, and widespread mask wearing. These measures helped to slow the spread of the virus, but also resulted in economic hardships and social unrest. The third wave of COVID-19 is currently underway, with the virus continuing to spread in many countries despite the widespread availability of vaccines. This wave is characterized by the ongoing rollout of vaccination campaigns, as well as the emergence of new variants of the virus that may be resistant to current vaccines. The third wave is also marked by the increasing use of technology, such as mobile apps and wearable devices, to track and control the spread of the virus. In conclusion, the COVID-19 pandemic has been characterized by three main waves, each with its own unique characteristics and challenges. The first wave was marked by widespread confusion and fear, while the second wave was characterized by the emergence of new variants of the virus and more strict measures to control its spread. The third wave is marked by the ongoing rollout of vaccination campaigns and the increasing use of technology to track and control the virus. Understanding these waves is important for effectively managing the ongoing pandemic and mitigating its impact on communities and economies. COVID-19 impacts on economy of developing countries. The COVID-19 pandemic has had a profound impact on the global economy, but its effects have been particularly severe in developing countries. These countries often have weaker healthcare systems, less developed financial markets, and less diversified economies, which makes them more vulnerable to economic disruptions. In this essay, we will examine the impacts of COVID-19 on the economies of developing countries, including the short-term and long-term consequences. One of the immediate impacts of COVID-19 on the economies of developing countries has been a decline in economic activity. The pandemic has disrupted supply chains, reduced consumer demand, and led to widespread business closures. This has resulted in a decline in gross domestic product (GDP) in many countries, as well as increased unemployment and poverty. For example, the World Bank estimates that as many as 100 million people could be pushed into extreme poverty as a result of the pandemic. Another impact of COVID-19 on the economies of developing countries has been a decline in foreign investment and tourism. Many countries rely heavily on foreign investment to finance their development, and the pandemic has caused many investors to withdraw from these markets. Additionally, the decline in international travel has resulted in a decline in tourism, which is an important source of income for many countries. This has had a ripple effect on other sectors of the economy, such as transportation, hospitality, and retail, leading to further economic disruptions. A third impact of COVID-19 on the economies of developing countries has been the disruption of education and training. Many countries have closed schools and universities in response to the pandemic, leading to a decline in enrollment and a reduction in the quality of education. This has serious implications for the future workforce and the long-term development of these countries. Despite these challenges, there are also opportunities for developing countries to emerge from the pandemic stronger and more resilient. For example, the pandemic has accelerated the trend towards digitalization and the adoption of new technologies, which can improve the efficiency of businesses and government services. Additionally, the decline in global travel has created new opportunities for local businesses to capture a larger share of the domestic market. In conclusion, the COVID-19 pandemic has had a profound impact on the economies of developing countries, with serious consequences for economic growth, poverty, and employment. However, there are also opportunities for these countries to emerge from the pandemic stronger and more resilient, by adopting new technologies, diversifying their economies, and improving their education systems. Addressing these challenges and taking advantage of these opportunities will be critical for the long-term development of these countries.